Hello, this is a brief presentation of the preliminary results of the CUCO trial. This is a trial that aims to determine the effectiveness of catemet subtract against aquacell silver at the level of arterial colonization of vascular ulcers. Additionally, as secondary endpoints, the trial tried to analyze the effect of catemet subtract against aquacell silver on the level of pain during healing, the health-related quality of life, the percentage of wound reduction, the healing time, and complete healing. Moreover, the trial will assess the safety of catemet subtract in patients with vascular ulcers. The primary endpoint is the level of arterial colonization, evaluated with RT-PCR techniques, and as secondary endpoints, the trial will evaluate level of pain with a numerical rating scale, the wound reduction percentage through planimetry, the clinical evolution of the ulcer by the use of the RESPES 2-point scale, the healing time will measure in days, the complete cure, the quality of life by the use of the Charing-Cross Venous Ulcer Questionnaire, and adverse events. The design is a randomized controlled open-ended design with blind endpoint, also known as PROV trial. The study population are those patients with chronic venous ulcer located in the lower extremities with signs of critical colonization, treated in the health centers or nursing homes belonging to the District of Primary Healthcare of Malaga in the public healthcare system. The inclusion criteria are those patients with age over 18 years, with a venous-like ulcer, and with signs of critical colonization according to the Lafayette and Morse criteria, which implies the presence of at least 3 of the following 5 criteria: severe pain during dressing change, perilesional edema, local edema, unpleasant smell, or abandoned pus. In the case of the existence of these criteria, a sample of exudate will be collected for analysis. The exclusion criteria are those patients under 18 years, denial to participate, or ulcers that do not comply the Lafayette and Moore criteria. Also, arterial ulcers will be excluded, or those patients with type 1 or type 2 diabetes without pedis pulse, or those patients with immunosuppression of any etiology, patients with acute rheumatoid arthritis, patients with dermatitis prior to the appearance of the ulcer, or patients with neuropathy or lack of sensitivity of any etiology. The sample size with those power and confidence levels is 186 patients, but this sample will be increased up to 204 patients to cover any possible patient dropouts. Randomization will be concealed to the participants and is generated by a computerized system. 102 patients have been randomized through this sequence to any arm of the trial. The data collection comprehends baseline data collection where patient and wound characteristics will be collected. A first follow-up period in the week number 4, where wound characteristics will be collected. At week 8, and finally at week 12, when newly patient and wound characteristics will be collected. An important innovation of this trial is that the features of the wound will be recorded by the technique of planimetry. This is a technique that leads to exactly an objective measure using image techniques to obtain an accurate surface of the wound. The dropout criteria of the patients are clinical deterioration, lack of patient's concordance, or withdrawal of the patient's consent. How is the state of the trial? The recruitment until the last week of November, we have 44 patients recruited. This is at 21% of the total sample. In this slide, you can see the distribution of the recruiting health centers in the province of Malaga. In total, 18 centers are collaborating so far. The recruitment process is described here in this flow chart. We have 22 patients per arm. And the baseline characteristics of the patients are mean age of 70 years. Female patients are significantly older than male patients. The distribution between male and female is more or less balanced, with 54.5% of patients being female. The ulcer location is mostly concentrated in the perimalleolar area. The time of evolution in months is 3.4. The mean ulcer surface is 16.1 square centimeters, and the level of pain in a scale with a range of from 0 to 10 is 5.4. The level of functionality of the patients measured by the Barthel index is 79.1. This index ranges from 0 to 100, and the nutritional status is optimal. Here we can see some images of the ulcers taken for the planimetric procedure. And here we can observe some measures with the planimetry software and the accuracy of the measures. This is another additional example. Well, the baseline characteristics by groups can be observed in this table. I have to remember that these are blinded data because the evaluator do not know which group is group A and group B. Well, after the randomization process, the baseline characteristics by groups are similar. There are no statistical differences in age, number of Lafreth-Moore criteria, ulcer surface, Respe scale, pain, Barthel index, nutritional status, or baseline health-related quality of life. The bacterial map that we have obtained after this first preliminary analysis have highlighted how the two main strands, Pseudomonas aeruginosa and Elcococcus kunzi, as the main microorganisms present in the bed of the wounds. By groups, we can observe a little difference, almost significant, in the presence of Elcococcus kunzi. But in the rest, except for Staphylococcus, in the rest of bacteria, the distribution is similar between groups. In the case of Staphylococcus, we have observed a higher proportion in one of the groups, and this difference is statistically significant. We can observe this difference in this slide. The main hypothesis test of the study implies that the null hypothesis states that there is no difference among the level of bacteria in the groups. The baseline characteristics reports that there is no statistical difference, and in the first follow-up at week 4, we have found no statistical difference. The secondary aims of the study, we can see the ulcer surface, the percentage of area reduction, the RESP scale, and the level of pain, with no statistical differences in these secondary aims. And finally, here we can observe how is the distributed dressings among the participating healthcare centers so far.